So when an individual has pain in the thoracic spine, typically occurring between the shoulder blades, we may have done some manual therapy techniques to try to increase the range of motion and to increase the symmetry of the motion. That then needs to be followed by some form of exercise. But the exercise needs to be controlled and needs to be able to make obvious where the asymmetry is. So we're looking at rotation and lateral flexion. Now these are coupled movements in the spine, so we could arguably just do one. However, it does enable us to find which part of the spine has less movement and to focus on that, so it can become quite pain relieving. So what we've done with Annabelle here is to get her sitting the wrong way round on the chair, and that's very important, because the first thing we're going to do is to align the spine, and then secondly, as we do the movement, we're going to support the spine. So she's sitting upright, so as she rotates, she's going to be rotating through a straight spine. She then turns towards the chair back, hands come up onto the chair back, and then the elbows are lifted to allow space for the shoulders to rotate. And the action is to turn as far as she can, and then when she gets as far as she can, she just puts a little bit of pressure on from the arms. So she's able to control that herself, and obviously if she's working in an office environment, she could do this, a couple of times a day to try to increase that movement. So the arms enable her to lift the rib cage and perform the sternal lift action that we described earlier in the text, and to rotate under control. And obviously she would then need to sit facing the other way to do the rotation in the opposite direction. We can then look at lateral flexion, so if you just stand yourself up, and what we're doing is bending over to the side, just come to the side, but we're going to use a support. So as she bends sideways, we can lift the arm above the head to open the rib cage on that side and to stretch the lateral line. As she comes over, there's quite a lot of stress on the spine, so we've got her to put her hand on a chair back, but this could just as easily have been a work surface at home, a kitchen work surface, or even an office desk. So she's leaning over, arm towards the ear, taking the weight on this lower part, and we're allowing this area to open up. If we want to put more emphasis onto the pelvis here, if you just bend this knee, we can allow that hip to dip down, and that then draws this area out. So if we're trying to focus on the quadratus lumborum as well as the latissimus dorsi, that action takes care of it. So we've got supported rotation and lateral flexion.